Minoxidil is the world's most used hair loss medication. In today's video, I will explain you everything you need to know before you make the decision to use it in order to treat androgenic alopecia. First, let's start with the history part. Minoxidil was first invented in early 70s in order to treat hypertension and high blood pressure. After a few years of this medication being available and used by customers, doctors noticed that their patients developed hypertrichosis, which is extra hair developed over their chest, shoulders and back. When they noticed that, they reformulated minoxidil into a topical lotion in order to treat androgenic alopecia, aka male pattern baldness. FDA approved minoxidil to treat hair loss in 1986 as a 2% concentration and later on the 5% in 1993. Now let's discuss about the formulations, which comes in concentrations and forms. The 2% is mainly used by women and the 5% is used by men and sometimes women that don't have any benefits from the 2%. Any concentration higher than 5% it's mainly and only used by men. This should be applied topically over the targeted area once or twice per day. You have three main forms: lotion, foam and oral, and the dosage may vary between 0.25 and 2 milligrams per day depending on gender and needs. Minoxidil's mechanism of action is the following. Because it's a medication, it's a pro-drug, meaning when you apply it over your targeted area, your body is going to receive it and is going to metabolize it with the sulfate and is going to be absorbed, and like that the benefits of the medication are going to occur. In this drawing right here I will explain you how minoxidil works when you apply it topically. When you first spray over your scalp or beard area, the lotion is going to first touch the dermis. After that is going to go to epidermis in the papillary layer with red right here and is going to get metabolized with the sulfotransferase process and the hair growth benefits are going to start. The most interesting fact about minoxidil is that it has been used by millions and millions of customers worldwide and is the hair loss medication with the most amount of studies, and yet nobody knows the exact mechanism of action. So far, the scientists discovered three main possibilities. One, increase vasodilatation of the capillaries, meaning more and more blood are going to be pushed to those tiny veins to your hair bulge area. Number two, increase fenestration to the hair bulge area, meaning small cuts around the hair papilla and hair follicle are going to occur, so more and more blood can be pushed that way. And third, creation of new ATP potassium channel openers, which are going to create new small gates around your hair follicle, so more blood can be pushed through that way. Your scalp hair growth has a life cycle which goes like this. First, it starts with the anagen stage, which is the growth stage where the hair shaft is being attached to the hair follicle. The hair matrix starts to produce a lot of keratin in order to fill in the hair shaft to make it longer, thicker, darker. This stage takes anywhere between 2 and 7 years depending on your genes. One of the amazing parts of minoxidil is that it has an amazing skin absorption and it will stay locally where you apply it and will not go systemic. After that, the catagen stage starts where the follicle is getting detached from the hair shaft and it's going to stop the blood nourishment. Lastly is the telogen stage, which is the resting stage where your hair shaft is going to stay into the skin until the hair follicle is going to start the new anagen stage in order to make room for the new hair shaft and is going to push the dead one out. What we know for sure is that minoxidil is going to prolong the anagen stage. When it comes to the side effects, I like to categorize those in two main categories. Minoxidil ones, which is the prodrug, the medication side effects, which is headache, weight gain, or increase of heart rate, and the recipe side effects, which is irritation, dandruff or itchiness. Over 95% of the customers that are using minoxidil and see side effects are because of the recipe and not because of minoxidil raw ingredient, which means it's extremely important for you to try different brands with different formulations in order to find out which one is the perfect fit for your needs. Now let's discuss about my personal tips. First, avoid aspirin because aspirin is going to reduce the sulfate production from your liver and is going to negatively impact the sulfotransferase process, which means minoxidil is not going to get efficiently metabolized. Don't use minoxidil orally because it will go systemic in much higher percentages and the possibility of you developing hair over your chest, shoulder and back will increase, and I'm pretty sure you don't want that. As well, the half-life of oral minoxidil is between 3 and 4 hours and topical is 22. 1 hour after application, avoid any physical activities that will make you sweat because that's going to open up pores and the product is going to be absorbed much in depth and can cause all the possible skin related side effects. When you first use Minoxidil and you see any kind of possible side effects, always remember the categorization I gave you here and take action based on what kind of side effects you have. And very important, after you apply the lotion topically, proceed with an active massage with your hands or a silicone scalp massager in order for you to help with product absorption and metabolization. This massage should be anywhere between 3 and 5 minutes and should be done until the lotion is fully absorbed into the targeted area. We have a video especially made for this. After you finish with this one, please go and check it out. That's it for today's video. Thank you so much for watching. I hope that everything I explained taught you everything you needed to know about Minoxidil and will help you make the proper decision if you want to use it to treat androgenic alopecia. Like our video to help us with the algorithm. Comment down below any questions you might have. We will reply to all of them. Subscribe to our channel and click the notification bell for our future hair loss and beard growth videos. Until next time, bye bye.